Hi, I'm Stephanie, and I'm a certified personal trainer.
Hi, I'm Kate, and I'm a registered dietitian nutritionist.
And this is a podcast dedicated to educating women on their journey to optimal health. There's so much that we can do to optimize our health, but we've talked to so many women who just simply don't know how.
These conversations are what inspired us to start Omnia Fit. The Omnia Fit podcast is all about interviewing certified professionals to educate women on improving our health. We'll talk about things like stress relief through exercise, what we need to know about our hormones, the truth behind fad diets, and more. So subscribe, follow along, and let us know if there are any topics you want to hear more about.
So, Dr. Sara, I am so excited to have you on this podcast. You really actually were like the first person to really help me on my health and fitness journey, because after I hurt my low back, which we can dive into later, I really felt like there was no solution in sight. And then I met you, heard that a chiropractor was a good person to go to. And so I'm really excited that you're on the podcast today.
Well, thanks for having me. This is such an honor to work with you, and I get to see the impact you have. So it makes me feel really like the whole reason why I do what I do is so that you guys can do what you need to do. So I love how you impact your community. So thanks for letting me be a part of it.
Of course, of course. So I think that's a good place to start. You know, I mentioned low back injury. I think maybe a lot of people assume chiropractic spine makes a lot of sense, but if you could just kind of give an overall sense of what it is you do as a chiropractor, I think that'd be a great place to start.
I think that, yeah, you're right. The most common notion is like, oh, chiropractor, just back. And being in the profession for now 10 years, it really just, each year someone asks me this, or each day, the answer always changes, because ultimately when I'm practicing chiropractic, it's to help remove any sort of interference in the human, like in the body, right? So whether it's tight muscles, whether it's misaligned spine or like vertebrae that impact our nervous system. So for me as a chiropractor, what I do is I like to help my patients reach their full potential through their health and wellness journeys. But honestly, it's working with the body to make sure that it's functioning well. We want to be able to reduce any sort of premature stress, premature signs of aging in the body, and optimize movement, optimize function. I'm a huge advocate of movement just being, movement being medicine, right? Like whether it's going for a walk or just like 5 minutes to, as I just did before this, just like moving my body feels good in so many ways. So chiropractic for me is really just helping the body function at its finest, using techniques that are super specific based on people's anatomy and x-rays to ensure that it's, something that's a good fit for them. But yeah, so just removing subluxation or misalignments from the body to optimize function.
And I can promise everyone listening to this that it works. If you go to a good chiropractor, I don't know if you want to speak to that, because I used to work in insurance, and I remember when someone applied to disability insurance, it was actually a question on there if you saw a chiropractor, and that could be almost a bad thing sometimes, because there's good chiropractors out there and not great ones. There is in every profession. So I don't know if you want to speak to that of, even finding a good chiropractor.
Yes. Absolutely right. There's a difference in the quality of physicians out there. And I think chiropractic is still, like in the grand scheme of things, still pretty young in its field. And so it sounds like a very umbrella term. Even like you could go to 3 different offices and find 3 different types of chiropractic care, if you will. So making sure that you start with an evaluation that has orthopedic exams involved. X-rays are something I advocate for. I do with all my patients, because oftentimes that's the biggest reason why I may take on a case or why I may not take on a case is there might be something more going on in that spine that needs, a little bit more invasive procedures or needs a little bit more attention than just the usual that, we assume is walking in. So having a thorough evaluation is so important when addressing care, and seeking out chiropractic. And honestly, like you'll see that in your results too. So within care, you should be able to have progress checks and make sure that that physician is checking to make sure that your goals are being done. So I would say, there are definitely, to answer your question, there's definitely a good group of good quality physicians out there. And then there's definitely those that don't necessarily do the gold standards of care.
Yeah. And I remember even when I first came in, because for the longest time, I thought I just had a low back strain. I thought it was just aches and pains. It's not uncommon for someone to have low back pain. And then I came in and you did the x-ray just because that was the standard, what you do for everybody. And that's when we found that I had a vertebrae out of place and was able to identify truly what was actually going wrong with me, so you could actually provide care.
Yeah.
And without that x-ray, we wouldn't have done that.
Yeah, and that x-ray showed us like the misalignment for sure, but it also spoke to so much to your anatomy, like your hip flexors being shortened. And so like that x-ray, yeah, it's so key because it tells a whole story about, you know, what it is that your body, how your body's been functioning in biomechanics in the last X amount of years. And when you're trying to solve something like our body that's used to doing repetitive motions every day, we definitely need that history from the x-ray too. So yeah, definitely very cool.
Yeah. And then you mentioned just in general misalignments and even talked about, you know, how that's not just the spine, but also how the muscles work as well. And a lot of people compare chiropractic to physical therapy. And I've even heard some people go as far as to say, do one and not the other. And, you know, they feel very strongly about who to go to for care. Would you mind speaking to the kind of the difference between chiropractic care and physical therapy, how they differ and also how they combine and can be compatible?
Yeah. So I'll start with chiropractic. So straight chiropractic or immediate chiropractic is speaking to spinal manipulation. And over the course of time, and especially here, I can speak to Illinois because this is where I'm certified, we take our boards in musculoskeletal too. So a lot of physical therapy that I perform is based off of my training and schooling similar to a physical therapist when it comes to that aspect. And so being able to do the manipulation to the spine in addition to me using sports medicine to kind of reinforce that is really what makes chiropractic in this clinic a little different. Physical therapists are also actually trained in spinal manipulation. I know that they don't practice it as often, but I've definitely encountered different therapists that do perform manipulation on the pelvis for sciatic. They'll focus more, it seems to be that they focus more on like using modalities to help muscle function. So like think stim, massage therapy can be an aspect that both apply, but I feel like for physical therapy, it does focus more on the musculoskeletal. And then chiropractic, straight chiropractic can oftentimes focus just on the alignment and the bones. And it never made sense to me to practice that individually because our muscles hold our joints in place. And so like it's your musculoskeletal system. Like it doesn't make sense to not have both addressed. And so I always tell patients too that are like, oh, I don't need to do the therapies, I'm strong, or and I'll let them know like your chiropractic care can have only so much benefit if you don't reinforce the alignment, and that's the job of the muscles. So the two bridge together so perfectly that I think to me it makes no sense when people are like, wait, why would we do both? Why wouldn't we just do one? When they're both tackling your musculoskeletal system essentially. So
Right. They absolutely support each other. And I know before I came in, I was very under the impression, and I know there are offices that do this, where you just go in for your quick adjustment and leave. And that's really all the care that you receive. Remember, every time I talked this location up specifically, I always talked about how the adjustment itself might only take a few minutes, but especially when I was going through the true care and healing from my injury, I was in the office for sometimes over an hour. Sometimes I'd have to add more time. And so I loved how it combined physical therapy with chiropractic care. But then I also love how even a few months ago, I've been in maintenance mode for a while now, just coming in once a month just to make sure that everything is still aligned and well. But you've told me that, I remember you saying almost word for word that, you know, chiropractic care can take you very far, but where your body's at now, you actually need more soft tissue work. You need to get more like loosening up the muscles and myofascial release and other techniques. So you actually referred me to start seeing other people so that my adjustments could continue to be great. So
it's so important to have that flexibility. And the cool thing is there's so many tools out there to accomplish flexibility, and it's to like have them work synergistically is so phenomenal. And it helps like you being a personal trainer and like some of your posts, I'm always blown away by what your body can do. And to support that level of like high function, I don't think that like one thing alone can accomplish that. So, especially with how much use you get of your muscles, it needs to be worked out. So I love that that's working out for you too. And, getting you to this maintenance level of care, like you put in the work, like it doesn't work out this way if you don't show up and do the homework and like put in the time that you've put to get to the level that you are. So I love that, you can see that looking back. Like there were times where I was here for like an hour and now I'm here for like maybe 15 minutes and it's quite a difference. Yeah.
Yeah. Cause there's still a few things that I do, like the wobble chair, which you can probably explain that better than I would attempt to. And then the traction afterwards. Maybe that'd be kind of a fun thing to kind of walk through what a typical patient coming in. I know every patient is different, of course, but generally what each patient goes through and why each of those things are so important to assist in their chiropractic care.
Yeah. So we'll speak so when a patient comes in at, let's say after their exam, I'll put together the first phase of care. So most people that are coming in with like what we would call like dysfunctional movement or painful movement. So to help assist them out of that and move them into more dynamic movement, we have various therapies. I would say the stretching is something that I get everyone on immediately because there's so much muscle compensation that goes on, whether it's upper back, neck, and we want to eliminate that muscle imbalance using stretches. So that's what like the pre-core accomplishes. We want to make sure that once we eliminate that muscle imbalance, we move into, correction and opportunity to shift the spine into more of that neutral curvature, translation, remove any translation. And so that's where we use something like mechanical traction for cervical curves. We're such an anteriorly dominant like society with our anterior chain. We're constantly looking at phones and like obviously we're looking at each other. So we just live like 90% of our day in this anterior chain, which really impacts our neck curve. So we used mechanical traction, and there's, as you've seen the 6 different forms that we offer, depending on where someone's curve is, to restore that curve, because that curve is so important in how your bone stress, or like how your bone ages and then is stressed, but also preserves the discs and their height. Recent article through the Journal of, I think it's like the British Journal of Science or Medicine, came out saying that they will no longer perform cervical surgeries unless there's like the curves in the mid and lower back to support that curve change, because that's how much an impact a curve can have. Is if your mid and low back are not, supporting the neck, then that procedure is only going to be so successful. So to speak to that curvature, that's what mechanical traction helps to accomplish.
So just to kind of translate some of the things that you were saying, when you're talking about that, like living very, what did you say, anteriorly?
And we're very anteriorly dominant.
This is where I said, I told you I make fun of myself for not being able to talk.
No.
So when you said we're anteriorly dominant, meaning if you're looking at your phone and it's in your lap, and so you're leaning forward, you're overarching forward.
Yeah.
If you're sitting at your desk or on the couch and you're kind of crouching, you're slouching.
Exactly.
Very just curving your body forward. And isn't there a stat, I think I probably usually get this wrong, but when your head's in a neutral position, and every inch forward your chin goes, every inch forward your head goes, doesn't it add 10 pounds of pressure?
I believe it's 3 to 5 pounds for every inch that's forward. Yeah.
Yeah. So if you're thinking about staring down at your phone, I'm physically doing it now, people can't see me, but if you're listening to this, even try it out. Bring your chin closer to your chest. That's however, like several inches forward, you're instantly adding 15 to 20 pounds of pressure to the back of your neck. And when we talk about doing traction, that's basically putting your neck in the opposite direction.
Correct.
Right.
Yeah.
And then you sometimes add even weight to it to help just teach that spine to go back to the curve that it's naturally supposed to go in. Right.
Correct. Yeah. So the weight, there's like a lot of muscle tightness for some folks in through the front, where just laying them back on that chair and using gravity alone isn't enough because their curve is so far gone. And so we'll add in some weights for sure to help get that progress faster.
I feel myself as we're talking. I'm like straightening up and sitting up.
I know,
bring
like,
my
how do I
shoulders
tuck my
back.
pelvis? Yep.
Yeah, exactly. Yeah, awesome. So we talked about the traction, and then, sorry, you're going on into...
Oh yeah, going into the wobble chair. So we call it the wobble chair just because it's, you know, a little bit easier to say, but it's actually neuromuscular reeducation that we're trying to strive for with the use of this chair. And what we're trying to do is engage our core, right? Like, how many of us spend 8 to 9 hours just sitting at our desks for the day and don't get to utilize our core? We engage our hip flexors a little bit more. And so what this does is it actually tries to engage our core while we're seated. So we kind of use that muscle memory comes back a little bit more. But the biggest benefit of this chair is disc hydration. So when we're sitting, there's a stat that says about 42 to 44% more pressure is added to our discs from when we're sitting versus standing. And that's lovely because of gravity, right? And so we want to use the neuromuscular reeducation therapy to help hydrate our discs, but also create like this corset effect of our muscles and our abs, abdominal muscles, our pelvic floor, to be able to reduce that constant like decrease in disc pressure. And it's so interesting that what comes to mind when we're talking about that is like 8 out of 10 times people will be like, oh, it's normal for my discs to be like this or be degenerative, and it's like, I wouldn't say it's normal. It's becoming typical to see that, because we don't spend enough time being preventative, you know, and being able to move around and all that. All we need is a little bit of movement for every like 40 minutes, get up for 10. And so we want to make sure that we're hydrating those discs, because that'll speak to nerve function being at its finest and minimizing nerve pressure. But yeah, so much goes into that whole concept in the first place. So yeah.
So for discs, I know that the things that go in between the vertebrae, but what actually are they? I just picture these like little bubbles that sit in between your vertebrae.
Yeah, they look like little donut sponges, honestly. But it's not cartilage. It's literally gelatinous material that's there, and that's pretty much it. It's like liquid, right? And so hydration is such a key aspect for our discs because it is liquid, and that's what makes discs a little bit trickier. Is they're not like our muscles where they have a supply of blood flow going to them constantly. They don't get replenishment of like nutrition through our blood supply, whereas most of our muscles and our tendons do. Discs will absorb water from our bones, from the bone above it and below it. So it's called this term called imbibition. Really fun term to say, but it's called imbibition. And what it does is that's how a disc hydrates. And so, yeah, to answer your question, it's like this, they call it nucleus pulposus. It's just this gelatinous material that makes up your disc.
I'm really happy you're saying all these big words and not me, because I would be messing all of these up.
Oh yeah, it's fabulous.
Yeah.
It's cool. When you're learning it, you're like, huh, what? And then you get to throw imbibition off your lips and you're like, oh, that's kind of a fun word to say.
Yeah, I'm so smart. Honestly, I like the term wobble chair. I like how you guys ease it up for us.
Yeah.
It's one of my favorite for people at home who haven't used something like this. I mean, it's an actual chair that is used for chiropractic care, but maybe a good example could even be sitting on a yoga ball, where you're sitting there and just kind of moving your hips side to side, rolling side to side, forward and back, just feeling that tilt in your pelvis. I like to joke, and I always feel like Shakira when I'm on it, because I'm like, ooh, my hips don't I can move them side to side, and but it's that movement that's causing. So it's basically that movement, almost massaging. Is that a good way to say it? That you're massaging your discs?
Yeah, absolutely. That's a good way to put it, I would say.
Yeah. So you go into that, and then we also have floor exercises you're mentioning.
Yeah. So floor exercises, I think that's like my favorite part of the sports medicine and the yoga instructor, and we just loves to be able to like fuse floor therapies and like fuse those two schools of thoughts together to help move into more agility, move into muscle firing patterns. It's really neat to see patients start out with like, you've done those single leg extensions, being able to see where people are so dominant on one side, and then they go to engage their left independently of their right, and it's like, what? How does this work? So floor exercises, are more of that reinforcement for just core strength, spinal strength, lower body extremity. We get all sorts of athletes. And so it's really a great opportunity to help support the joints that we use so often and so much, just reinforcement for that.
Yeah, I remember some of the exercises you've had me do. Even before I was a trainer, I was always a pretty in shape person, and you only had 2s, 3s, and 5s pound weights when I was here. And I would always go for the 5s, being like, this isn't going to be enough weight for me, and they don't have heavy enough weights. And then I would do some of the exercises you'd give me. I've actually saved some of them in my head, and I use them in some of my sessions when I see certain things with people. And every single exercise that I've learned here and I've implemented in my practice with clients, it's always their least favorite because they're so hard, and you literally only need 2s or 3s or even just body weight. Some of them are just so difficult because we're so unbalanced, and it's proof that we need those exercises.
Yeah. Our body is so amazing at working in, as you know, like combination movements, right? And so when you get to like strip back and peel, like have a muscle do its individual task by itself, it's like, it is definitely eye-opening.
Oh, it's very humbling. When I come in here, I'm going to grab the 5s, and then I have to quietly put them back and grab the 3s or just not use them.
That is
You
so
definitely
funny.
humbled me. So we talked a lot about pain relief, and you mentioned how a lot of clients will usually come in with some sort of pain and in a certain motion or things like that. So pain relief, of course, is one thing we've talked about in spinal realignment. You can even speak to that a little bit more if you'd like, but what other benefits can people see from?
Oh, love it. Okay. So I think the top 3 that people experience within like the first couple weeks is sleep. People are able to accomplish a deeper level of sleep as we're addressing the nervous system. So with the adjustments, as we're easing off the pressure off the spinal cord, essentially, in the nerves, your body's able to shut down a little bit better, get into a deeper sleep because it's more comfortable, essentially. People will mention, I don't wake up 3 to 4 times a night to adjust my posture or my neck or my back. But yeah, so sleep is probably one of the best ones, and so important for our mental health, right? Like October, just coming off of Mental Health Awareness Month, sleep has such a big impact in how our bodies recover, how our minds recover. The other thing that I think I've got the opportunity to work with patients on is their reproductive health. When we work with the lumbar spine, specifically your lumbar plexus.
Low back,
yes.
I'm just going to translate once in a while.
Oh yeah, that'll be nice. But you have this network of nerves in your low back that, it has your motor nerves, your motor and your visceral nerves that go out to your reproductive organs, your digestive organs, and people find both. Like, Dr. Sara, I used to have so much bloating or so much irregularity with my bowel movements, and I find that this helps. Well, yeah, because again, that nerve that was having interference due to whether it was faulty biomechanics, tight muscles, no longer is being disturbed. So I love when people are like, we were trying to get pregnant, and it happened sooner than we thought, and it's so neat to see reproductive. One of our patients, or one of our staff members, Janice, had PCOS when she started working here, and had just gone through the ringer with your typical protocol on PCOS. And what's PCOS? Polycystic ovarian syndrome. And so these cysts that form on your ovaries can be pretty problematic and cause a lot of irregularities with your cycle too. And she had, it was interesting, but she was one of those patients that shared her story with other females about their, their health and their reproductive health. And we were able to work a lot with PCOS patients, fertility patients. So I guess I would say first is sleep, reproductive function are the other benefits. And then with children, I find that, and even adults, focus. Our cervical spine, which is our neck, has, our most important cranial nerves, our cerebral spinal fluid starts there. That's the stuff that flows through up and down the spine to nourish the spine. And when that gets blocked for whatever reason, whether it's traumas, micro traumas from posture, it does start to give you a foggy feeling. And so focusing can be a little bit harder. And so patients will find with cervical adjustments, I once had a patient get off the table and be like, it feels like you literally, like we just flushed the toilet in like my head. And I was like, what? Like, what do you mean? He's like, I came in so foggy. And after that adjustment, I just feel really like clear. I feel like a good surge of energy. So like that endorphin release. So I would say those are the top 3 that there's plenty, but those are probably the most commonly shared from patients from their perspective.
That's amazing.
Yeah.
I know even I had a concussion once and I was told to go get an MRI. And I mean, those are still good things to do.
Yes,
but
absolutely.
I remember having kind of that similar feeling where I came in, my head was aching. I was out for like a week, not being able to stare at a screen or anything. And then I came in, I think I remember calling. It's an oxymoron. But I remember calling and you said, no, come in. We'll adjust you. And you did a different technique than you usually do with me. But I remember that feeling of just relief, where just that vertigo type feeling. And it just felt the way you described it, it actually felt like there was just this fogginess that flushed. Yeah, exactly. Yeah. It was such a strange feeling.
Oh, that is very, very cool. But yeah, a lot of patients will experience that clarity of like that pressure release from various parts. So yeah, that's a really cool way to look at it.
Yeah. And even going back, I was looking around and I saw this, you even going along with the tools and other things that you do. I remember when I first came in here, I got a couple, we'll call them presents from you guys, where I got my orthotics and back brace as well. So you guys also, and there's like chiropractic pillows that we have. So just tools for patients to use at home as well, out of the office.
Yeah. Yeah. Because the goal, I always tell patients when they come in, my goal for you is to be able to get you better, get you to an optimal state of function and pull back. Because like, we don't want you to be coming 3 times a week for the rest of your life. Like that should not be the case.
Right.
So as we support your body to get to that level of function and day-to-day just stability, we want to be able to offer patients tools that they can use in conjunction to help that transition too, because things like orthotics help dissipate a lot of that shock that we feel from the bottom up.
And orthotics are like shoe inserts. Basically,
Correct.
They're designed for your feet. You did like this whole measurement thing where I stood on the scanner and it kind of was like a copy machine, scanned my foot.
Yeah.
Right?
Yeah, totally. It takes measurements and measures the arches, where you're displacing your weight, whether you're falling on the inner arch of your foot, the outer, heel strike, forefoot strike, all these various things. And based off of that, it generates a custom mold orthotic for you. And it helps us maximize efficiency through your joints. We have this like one set of joints to take us from now until 100, and so we want to make sure that we're optimizing those joints and how they're aging.
Yeah, that's awesome. For people who are listening to this and might still be a little nervous to make an appointment with a chiropractor, because I think it's even safe to say, even if you don't have pain, it's good to come in and just have an initial assessment, see if there is something that chiropractic care can help with. I mean, we all pretty much sit at our desks, have a forward lean, probably have some neck pain, probably have some low back pain. We all probably have some fogginess, probably some trouble sleeping. I mean, there's a million reasons to come in, even if you don't have a severe low back injury like I did when I first came in. But if someone's still nervous to do so, what would you say to them?
I would say, I think you said it so perfectly. It's just coming in to get checked doesn't necessarily mean getting care. It's literally just that. It's talking about bringing awareness and talking about what's going on, whether it's, physical for you or whether it's anxiety or depression, like just getting an idea of where patients are, because it is a holistic approach that we work with. And so I would say if you feel comfortable with taking some time, and I mean, how often do we take time to put into ourselves? So it's kind of like that self-care, like let me take time to work on myself. And that's really what it's about. It's just coming in, chatting, and seeing if there's anything that comes to mind that you want to work on. And if there is, great, we're here to support you. And if there isn't, then cool. Like at least you know where you are now and how to continue to do that for yourself.
Mm-hmm. That's amazing. And then if anyone has questions or looking for resources, is there anything with Chiro One or anywhere that people could go to kind of get more information aside from popping into the office here and saying hi?
Yeah, absolutely. Our website, so chiro1.com, has plenty of blogs and resources on there for frequently asked questions, various conditions that is accessible. And if they want to ask a specific question, like even on that website, each clinic has an email. So if patients wanted to ask more specific questions about themselves, they could always shoot me an email, which is the address is available online.
Which there are lots of Chiro One offices, but even though I live closer to there's 2 or 3 other offices that are closer to me, I still drive here to the Old Town one. So if you're in Chicago, come to the Old Town one and say hi to Dr. Sara and everybody else here.
Oh, that's awesome. That is such a that's like one of the best compliments. So thank you, Steph.
Of course. Well, thank you so much for this episode. I hope people learned so much from it, and hopefully more people will seek out chiropractic care from good chiropractors and get healthy bodies.
That is the goal. That's the goal. Optimal potential and healthy aging.
Yeah.
I think one of my terms, it's on my little vision sheet here, is, what is it called? Lifestyle of a super ager. That is my jam. So
I love it.
Supporting myself in that, but also supporting my community. So yeah, I would love that.
Awesome. Well, thanks so much.
Of course.
Feeling inspired yet? We've got you covered. At the very end of the season, we'll be launching our OmniaFit website. You'll be able to access a platform filled with on-demand workouts like yoga, HIIT, Zumba, bar, and more from several amazing instructors. You'll also have access to meal prepping tips, personalized grocery lists, and dozens of recipes given the official okay by our incredible dietitian, Kate.
Along with everything Stephanie mentioned, you'll also have access to schedule appointments with some of the licensed professionals featured in this season. Email info@omniafit.co to stay updated on our November launch date. You'll want to stay tuned because our first season listeners get their first month free. Just use promo code POD2021, that's POD 2021 to redeem.